Start working on not touching your face.
Do as they say, not as they do. 60 seconds after this public health director from California warned everyone not to touch their face, watch what she does. Yep, she actually licked her fingers to turn a page.
One of the key parts to preventing transmission is washing your hands and not touching your face.
Same with Representative Alexandria Ocasio-Cortez. She kept fussing as she advised Americans. Just more proof of how hard it is to give up the lifelong habit of touching your face.
I haven't touched my face in weeks.
Not so fast, Mr. President. Photographs show President Trump resting his hands on his face, all during the coronavirus crisis. It's usually spontaneous, and we're not even aware of it. The View co-host Joy Behar admits she's a frequent offender.
I'm twitchy.
The eyes, nose, and mouth are the portal into the body for germs.
I've become, as I'm sure many of your viewers have become, hyper aware how often we shake hands and might exchange a droplet, how often we then go back and touch our face, our mouth, our nose.
Dr. Ezekiel Emanuel is a special advisor to the World Health Organization.
It's not the air. These aren't free virus particles sitting in the air. It's droplets. Coronavirus goes by droplets. So it could be someone sneezed on you, laughed at you, or it could be that a droplet came out of their mouth, it hit the surface in the kitchen, you put your hand on that surface, and then you touch that surface to your mouth.
This doctor actually uses a plastic shield to train patients to avoid touching their face. It's also a struggle to avoid shaking hands, especially if you're in the public eye and want to be polite. Just look at Melania Trump and Joe Biden this week. They're still greeting people with a handshake. Stephen Fabian talked to Dr. Oz about another health hazard these days.
You always hear your phone is so dirty.
Oh, phones are dirtier than toilet seats. We've studied it. And the reason phones are dirtier than toilet seats is because you clean a toilet seat. You never clean your phone. So start doing it.
Disinfecting smartphones is not as easy as you think.
That the manufacturers sealed the phone with some kind of chemicals that if you attack with Clorox or Lysol or alcohol, there's a really good chance you're going to mess up the waterproofing and or the screen itself.
So what do you do?
The first thing you do is turn it off.
Okay.
Then you've got your alcohol mixture, which
is alcohol and water.
It's alcohol and water.
And what is the percentage?
It's roughly 2/3 water, 1/3 alcohol. Here I have a microfiber cloth.
Okay.
And I would dip it in here. This is an iPhone. It's got a glass case. And I can absolutely clean the phone with it.
Here's a gadget that might help. A smartphone UV sanitizer, which claims to neutralize bacteria with UV light. The Inside Edition digital team is fielding questions from viewers across the nation, and now Dr. Zeke is answering them.
How do you know if it's a coronavirus or just the regular annual flu?
You don't. That's why we have a laboratory test, because you can have the same exact symptoms, and actually that's one of the reasons public health people are recommending that you get the flu vaccine, to kind of minimize that as a possibility.
I know you want neither, but if you had to choose, coronavirus or the annual flu?
The difference is at this moment, we're quarantining people who have the coronavirus, isolating them for 14 days. So if you have coronavirus, not only are you sick and having to recover, you're going to have that isolation quarantine period. And that, I think, is the added complication of coronavirus at this time.